Good afternoon. I want to thank everyone for joining us today. It seems like Fridays are coming by a lot faster than they used to with the shelter in place order that we have given the uh, COVID-19 pandemic. But certainly I want to thank everyone for their patience and for their cooperation. I want to talk about a few things today, but I'm going to start with something that's not related to COVID-19, but is related to city of Montgomery, our community, and policing in not only this day and age, but all around this nation. And that is the unfortunate circumstances surrounding the shooting and killing of Greg Gunn several years ago. The city and the Gunn family this week reached a mutual settlement of the civil lawsuit that was brought against the city prior to my administration. It is something that was a high priority for me. It was something that I thought we needed to address in order to not only try to allow the family to move forward from their pain, but also this community. And while the settlement will not bring Mr. Gunn back, it will not erase the pain to his family and his friends. It is something that I think was necessary for us to be able to try to learn from the unfortunate circumstances surrounding his killing and surrounding policing in not only Montgomery, but the state of Alabama, and how we can do a better job of protecting and serving. And so it's a lesson for all of us, unfortunately, that came at a tragic cost and one that cannot be measured in any way by any settlement amount. And we are certainly thinking about the Gunn family, his friends during this time. And we are also making sure that as an administration, we are sensitive to the issues that many people face as it relates to their trust with the police department, with government itself, and why that is. And so we know we have work to do where that is concerned, and we'll continue to learn and try to improve on that. I also want to make sure that I thank all of the members of this city and this community for your steadfast work to make sure this incident did not rise to some of the levels of past incidents in this city where police confrontations were noted and recorded, and some of those ended up tragically, and also given what we've seen throughout this country. And so I think the city of Montgomery and the community leaders and community members all have played a good role in that. And I certainly want to thank you for keeping us together during this trying time. And again, while this will close one chapter in the city's history, hopefully it opens up another chapter of us being able to learn from the situation and move forward. Now, I want to move into some of the things that have been talked about in the last week regarding the COVID-19 pandemic. First, I want to thank all of our first responders, our police, our fire and rescue, our medical workers, our grocery store, retail folks who are doing the best they can, and they're really on the front lines. I certainly want to thank our sanitation department and our street maintenance crews for the work that they've been doing as well, and so many others who've really been out there day in and day out on the front lines throughout this crisis and pandemic that we're into now for the second month. And so while we're doing that, we want to make sure that you kind of keep some information in its proper place. And what I mean by that is there's a lot of talk about opening up the economy. And while all of us want to get back to work, all of us want to see our stores open, all of us are ready to get off of self-imposed shelter in place, house arrest, whatever you want to call it. You know, I think we have to be very sound in our judgment and how we go about that. And it's something that's very hard to do when people are being furloughed, they're missing their paychecks, and they can't provide for themselves. And they're just kind of also missing, you know, being with loved ones, being able to go see friends, and being able to be around coworkers and colleagues and neighbors. And so that in itself has been a challenge. But we want to make sure that we're doing the right things by your health, most importantly. A city government depends on tax revenue. Without tax revenue, in particular in the state of Alabama, that relies disproportionately on sales taxes to generate services, the city cannot operate. And so I will be at the front of the line to get the city back open and going, and the state of Alabama, for that matter, back open and going. But we have to do it the right way. And we have to make sure that we can further test people in a way that allows us to really get a better sample size. Right now, we've only tested 1% of the population in the state of Alabama. And that's not enough, in my opinion, to generate a sample size that can give us the data that we need to decide whether or not we should open. Second, in Montgomery, we're even less than that. We tested the least amount of any large city in Montgomery, which is why I was excited when Hyundai Motor Corporation responded to my letter that I sent about a month ago, asking them to provide us with test kits. They did that. They came through in a great way, and it's a perfect example of a public-private partnership. That being said, we have to make sure still that we work towards self-isolation and making sure that we are sheltering in place and keeping in mind those social distance measures that have gotten us to the point where people feel like we should be able to get things back to normal. And that is washing our hands. That is making sure that we are practicing the 10-by-6 rule. No more than 10 people spread 6 feet apart. We also want to make sure that we are doing those necessary things to sanitize our phones, to disinfect doorknobs, even our clothes. We should be trying to wash our clothes a little more regularly. We have to do all of these steps because of what we're dealing with. And unfortunately, we know now that this virus disproportionately affects people in the Black community. That's only exacerbated by the fact that many people in the Black community do not have equal access to health care and have underlying health conditions. So for these reasons and many more, we have to make sure we're taking the right steps. Now, I believe the faucet will be turned on here pretty soon. And what I mean by that, I do think there will be a gradual reopening of our economy coming up, but we should understand that it probably won't look like it did in January. It will probably look a lot different. I expect to see reductions in capacity for retailers. I expect to see still the 10-by-6 or at least the 6-foot rule put in place. I believe that we'll see still people teleworking after the economy opens up. And I think that we will continue to see some steps being taken to try to minimize the impact. That being said, we don't want to bring about another wave prematurely of the COVID-19 virus and overwhelm our healthcare system. We've done a good job by being very disciplined in this manner, and we want to continue to do that. And so that takes us being patient just a little while longer. I think making sure that we protect our most vulnerable citizens, our seniors and those that may have pre-existing conditions, and we not rush this forward. We have to be sure that we continue to not fall into a false sense of security because we're seeing low numbers. We don't want to have a disaster happen on our watch because we didn't take this seriously enough, or we came out of our shelter in place or out of our habits that have gotten us to this point too soon. So I want to encourage everyone, let's be smart in our decision making. Let's be patient with ourselves, with our neighbors, with our family members, and let's make sure we don't rush to judgment on this. And so with that being said, I have a guest with me today that's going to talk about mental health and the importance of that in this type of crisis, because many people may not pay as close attention to what their mental health needs may be or how to identify those who have those needs. And unfortunately, it's a little bit harder to get help in an already understaffed system right now because of the shutdowns, because of the limitations of government. So we want to bring on a professional, someone with an extensive background in this area, just to discuss with you for a few minutes what steps you can take, what things you can look out for, and how you can make sure that you're keeping your mind clear, and that you're making sure that you keep the mind clear of others who may be suffering from a mental illness, who may be suffering from depression or any other designated mental illness. And so at this time, I want to turn over to Krishula Edwards to really talk about that issue and to really give us her expertise and background and things to look for.
Thank you, Mayor. I really appreciate the opportunity to come in this evening in Montgomery to share this information. Many people have had many thoughts and things that they have going on during this pandemic and why they're staying inside, and they're wanting to know what is the things that they can do to help with their families and their children to make sure their mental health, emotional well-being is taken care of. Now, some of the things that individuals may be experiencing during this time, of course, is isolation. If you're staying inside and you're not an essential worker and not having to go to work, for families that have an essential worker and they work in home and they're coming home from work, you may be worried about catching the virus or spreading it to your loved ones. And your loved ones may be fearful of you because they don't want to catch it also. You may be feeling depressed, also worried about your job, like the mayor talked about. Some jobs have had to lay off individuals, so you're worried about paying your bills, and also when after this pandemic is over, about where you're going back to work, are you going to have funds to feed your family? During this time frame is very critical. A lot of people are very lonely. They don't have anyone in the household with them or families to call and check on them during this time frame. So they're really going through a very depressed and isolation time in their life, and not being able to go outside just to have individuals to look at and talk to. Many of our elderly citizens, they do like to enjoy going to the park, going to the mall, and other establishments where they do get enjoyment of walking around, seeing others, and interacting with them because they do live alone. During this time frame, if you are experiencing any of these symptoms, it's important to take a step back and examine yourself and look to see how you're doing and if these things are persistent and becoming very, very serious. If you are experiencing any symptoms of depression, meaning that you are very tired during the daytime, not tired from staying up all night, but excessively tired, and this is something that's not of your norm, then you do need to reach out for help. Some of the things that you can do to help with your depression is, one, get back on your regular routine schedule that you had before. You know, wake up in the morning at a reasonable time, get up and put on clothes, cook you some breakfast, you know, or any type of food that you like. If you're able to go outside in your yard or your balcony, do go outside to enjoy the sunlight when the weather permits, so that you don't have to stay inside all the time. If you are able to go out and you do have to go to work, it's very important that you do put on your mask, your gloves, have your hand sanitizer, and wash your hands constantly during this time frame. It's also important to stay updated on news, but also remember not to get over exaggerated with the news intake that you do receive. Pay attention to your local news, most importantly. A lot of the news that you do look at and receive is not always helpful. You do not want to overexert yourself with some of the stuff that you're receiving to make yourself go into a panic attack. It's also important to remember one important thing, that you do have to let go of the unknown, because these are times that you cannot control. It's important to understand the things that you can control during this time frame and the things that you cannot control during this time frame. Also, during this pandemic, it has been an uprising of domestic violence and sexual assault, because individuals are forced to live in the house 24/7 with some of their perpetrators and people that are becoming irritated during this time. So therefore, if you're in a situation that you think that is not safe, please reach out for help and get some help. If you're a person that you have been drinking excessively during this time frame and you're becoming irritated because you having to stay in the house, please do a reset to yourself. Maybe it's time to stop the drinking, and it's also time to reach out for help. Let's make sure that we check on each other during this time frame. That'll be very helpful also to each other mentally and emotionally, just to have an accountability person to call to check on you. So to make sure that you're doing things okay, that you're getting up, that you have all the central things that you need during this time frame. Also, it's important that you reach out to a counselor or a therapist during this time frame. Many of us are doing therapy, telehealth, meaning over video or over the phone, so that you don't have to see us face to face and be fearful of your life of contacting any of the virus. But please reach out. Many of insurance companies, they are waiving fees and they do have it accessible for you to reach out to counselors or therapists if you need to. Also, make sure you stay in contact with your physician. Contact your medical physician doctor and let them know if you are experiencing anything and see if it's something that can be done on a medical term for you, because sometimes people have underlying medical issues that sometimes they're not able to do remedies and self-care things to help them at home, that they do need further help. So there is help out there for you. Please make sure you reach out and help. Let's check on each other to make sure no one is getting depressed to the point that they are thinking about suicide or they're trying to harm themselves. This is a very trying time now in our society, in our nation, and it's up to us as citizens and people to look after each other and to help each other.
Thank you. I could not agree more, and that is very helpful. I think not only to myself as a former probate judge who saw so many cases of involuntary commitments and people dealing with those issues that you mentioned, but certainly counselors in our schools, counselors in this community, and people like yourself who are helping people through these trying times. So thanks so much for that information, and I believe that it's going to be beneficial to people, not only just during this time, but even beyond, because it's just something we don't talk about enough when it comes to mental illness and how we destigmatize that and how we address some of the other issues that you brought up. So I want to thank you again for offering your background and some suggestions. And I'm going to ask you to hold on with us just for a few minutes because I think that we're going to take a few questions and see if we've got anything to come in online.
Thank you.
So to the question about paying taxes and getting city services, really kind of comes down to if you're in the police jurisdiction or not. And so that's one question that you have to find out is, are you in the PJ or are you in an area where you should be getting services, and how do we get those to you? So all you have to do is call City Hall and we can answer those questions for you, and we can make sure to follow up with you in terms of whatever questions you may have about specific services. Is that trash pickup? Is that street maintenance? What are those services that you think you need and you think you should get that you aren't? And again, working at the county for a number of years, it's also sometimes people believe they're in the city and they're not. And so it's one of those things we want to make sure we check as well. So feel free to give us a call and we'll find out for you. The question was, can you make the city close to the end of the year? I hope not. Listen, the city has to be able to run and has to be able to provide services, for all of our residents and people who are traveling here on business and other means, our military. So no, we don't want the city closed for the rest of the year. We want to get open, but we just want to be prudent about how we go about that. And ultimately, it's going to come down to you, the individual, how you prioritize, how you get back into this new space that we're in, because it is something that is unique. It is something that, I think is going to change how we do business, how we go to school, how we worship, how we do government, how we shop, how we eat. It's going to change everything. And, we're already hearing some projections, whether that's with touchless door knobs and elevators long term, or kind of backing up a little bit whether that is more distancing in the workplace for those that do come back to their physical workplaces, and whether or not, you know, those are more sanitary stations that are placed throughout the city and throughout communities, and what retailers as well as government and private sector companies are going to have to do in order to make sure the employees are not asymptomatic. And that's very key. And I didn't bring that up earlier, but you know, there are a number of people who are carrying the virus that are asymptomatic. And so all of that factors into our approach about how we, you know, go about this and what our priorities are. I want to take just a second to recommend something that was brought up, and that is the wearing of masks. We want to recommend that all of the residents of Montgomery wear masks when out in public or some type of facial covering. I understand the concerns that many in the Black community have about that and the profiling. We worked on that and we discussed that from a sensitivity training standpoint here in our administration. Now, obviously, you have to weigh the risk of that in terms of how you go about doing it. As someone who was held up before, I wouldn't advise anyone to do that as the door is closing in an all-black suit. So, you know, you have to kind of keep some of those things in mind and make sure that you're balancing the practical nature of what we're recommending with obviously some other issues that society still has to address, not just here in Montgomery, but throughout this country. Is that what you want to take that?
Yes, sir. The question says, if someone is in an unsafe place at home or situation, where can they go for help? That's a really good question. Well, the Family Sunshine Center, we are still open, our office and our shelter. So feel free to call our office. The number is 334-263-0218. And again, that phone number is 334-263-0218. You can call our office. That's a 24-hour crisis line number. Someone will pick up no matter the time of the day, and we will make sure to get you some help. Also, the Montgomery Area Mental Health, they are also available if you're experiencing any situation that's not an unsafe situation at home, dealing with abuser, but you just need someone to talk to dealing with depression. They are also available to take your phone calls and to get you some help also. Anytime that you also have situations going on, there's always the 1-800 numbers that you can call for the suicide hotline number. If you look at my shirt, I am promoting suicide awareness. You know, get you some help. There's help out there for you. Do not stay home and think that no one cares about you and that you are alone in the situation. We are all at home alone in this situation. So there's help out there for you. So let's make sure that we give each other some help.
Thank you. I've got a question that's come in. The question is, the Lieutenant Governor put out some business recommendations today. What does that mean for business? Will they reopen today? Those recommendations are from a statewide committee that the Lieutenant Governor was a part of and may have formed as part of a task force, the economic task force for the state of Alabama. That recommendation, that report, I think will be passed on to the governor, and the governor will ultimately make the decision about how she lifts her shelter-in-place order that's still in effect, at least until April the 30th. And so businesses that are closed right now should remain closed until there's further communication from the governor's office that some of those recommendations or any new recommendations have been implemented and thereby they can reopen. But that is not the case as of right now here in the state of Alabama. I also have gotten a second question that came in via email. Are you going to follow Governor Ivey's recommendations on reopening businesses? Certainly, we'll follow most of those recommendations. I like to see them first whenever she chooses to review those task force recommendations and then issue her executive order. We're going to do everything we can to get the economy back going and get people back to work so that they can provide for themselves and for their families. That's very important. but we will not do that at the sacrifice of the health of the general public. And so we'll weigh those issues, and I'm sure the governor will do the same, and then we'll make our ultimate determination at that time. Okay, Ms. Edwards, I'll kick that one to you as well.
Okay. The question is, particularly, are there resources to address isolation, particularly how we can help our older population who may be isolated from family and may live alone? So the thing with most of our elderly, they may not be technology savvy to do like a Zoom call or webinar that you can talk to them via afar. But if they are, that is a good way to set up a Zoom call or FaceTime with them so they can see their face. Also, maybe just doing a drive-by their house and parking in front and having them walk to their porch or to their window so you can wave at them and talk to them from afar. Also, let's go back to our roots of pen pals. Maybe you can write a letter and put a stamp on it and mail it to them, and have them to go to the mailbox and read their letter and write you back something. If they're not able to write you back a letter, you just have to think out of the box and think of ways that may be feasible for them. Just having a conversation with them to see what is the best possible means of communicating with them. I know with my grandparents, I have done and parked at their curb and just waved at them from afar. And if it was just from the parking lot or from the driveway. So you want to make sure also that you're safe at whatever you do when it comes to any population, whether they're a child, they're a young adult, or they're elderly citizen. So let's just make sure that we're safe in all that we do.
Very well. I've got another question that came in. Are there any resources to address isolation and its effect on mental health? Is there anything in the city's proposed comprehensive plan that might address this kind of isolation in the future, or can something be added to the plan to do that? For instance, some people can walk into their homes to get exercise and fresh air. The plan addresses this with new trails and walkways for access, but some people are confined to homes. That's a great question. And, from the city standpoint, what we want to do is we want the parks to be open, and we want people to observe 6-foot social distancing guidelines that have been recommended by the Centers for Disease Control. That's important if you can get to the parks. We certainly understand that not everyone can do that. And part of our long-term plan is the sustainability and making this city more sustainable across the board for all of our residents. The city really wasn't laid out like that in its plan 60 years ago. And believe it or not, we're still operating under that plan. And so when you think about what the city of Montgomery looked like at that point versus what it looks like now, it's a lot different. And so it hasn't always been a comprehensive approach to things like walkability, bike lanes, parks, and things along those lines, and their accessibility to various neighborhoods. And so right now, we have that as a part of our plan, and it's certainly something that we benchmark against other communities and what's happening to try to make sure not only that people can address isolation in this matter, but people can also get out and get physical exercise. People can also get from point A to point B without having to get in a car. And people can also get to know their neighbors and someone in their neighborhood by walking safely along well-lit street via sidewalks or via walking or bike trails in a way that provides a better sense of community than may exist right now. So it is something that's in our plan, and it's something that we want to try to address as well going forward. And Ms. Edwards, I'll let you address any other issue that might be a solution, for problems with isolation during this time.
Yes, you can find new crafts or make new things for you to do, such as puzzles. A lot of people may not be into puzzle, or they may not have time to ever do a puzzle. Now is a really good time to start doing puzzles, putting them together. Some come in big pieces, some come in small pieces, but just really tapping into things organizing, finding a new craft, things that you like to do that you maybe have put off before due to timing, but now you have a set amount of time to get these things done. People that have kids at home, rearranging your schedule for them, I know has been tough, especially if you're still going to work and having to get a babysitter. But thinking about them, they're used to being outside. So having a schedule with them, still having them to wake up at their assigned time like they're going to school, and keeping them on task with their at-home school work and going outside. Also, maybe doing like a week of activities with them, like doing like a pajama day, a tacky day, having them to reverse the role of them being a teacher for the day, having them be a principal for the day, just making creative things and ways to have them engaged, to excited to be home, and also keeping them in the know as much as possible and explaining to them in their words of why they can't do certain things, because they're wanting to know what is going on. Anyone that's isolated and not able to get the things that they need, also tapping into your resources of your neighbors, letting them know to see if they're able to help them out. Churches, if you have any support groups, and also a lot of neighborhoods have neighborhood apps. Put in your neighborhood app, letting your neighbors know what's going on with you, so that someone can have some type of insight if you need anything. And also just to walk by your house and wave at you if you need to, come in your driveway to help you with something, or drop something off in your driveway for you.
Great.
Can you share information with us about families who have counsel about loved ones fighting virus? Okay. We have a question that says, can you share information about individuals that have lost loved ones during this virus? Now, that's going to be an ongoing process of healing, of grieving when you have lost a loved one, especially during these trying times, because per the CDC regulations, you may not be able to even go to the service, and a lot of different things have been going on. After this pandemic has passed, everyone is going to have to get used to their new normal. Not getting used to being normal again, but getting used to being a new normal, whatever your new normal is going to be. Many people have lost loved ones, so that's going to be an adjustment period of understanding how to move on with your life and cope with the deal of losing a loved one. Now, I would recommend definitely to get you some counseling, some grievance counseling of losing a loved one, and definitely talk to your counselor and let her know how you're really feeling, him or her, how you're really feeling about the situation, and tapping into resources, books, support groups, to make sure that you're getting an understanding and getting your feelings out there. And also, don't be afraid to express your feelings. Many individuals feel that if they cry or tell individuals how they're feeling, they're going to be looked at as weak or have a stigma above their head about something. But we're all humans, and we all have to go through things in life, and grievance is a part of life that we have to go through.
Very well. Thank you, and I want to thank everyone for the questions that have come in. I think we just got one last question that just came in, and I think it was how many people or what percentage of Montgomery's population should be tested for us to get a good sense of where we are on the curve. I think that's a fantastic question. I don't know if there's a specific number in my mind. I'll let the health experts and the infectious disease folks kind of tell us their thoughts on what's a adequate sample size. I just know that right now we don't have one, and that's because we've only tested a few thousand people. And so when you get to those numbers for a city our size, that to me is not enough for, and that few thousand is less than 3. I want to say it's less than 2. So it's not like I'm talking about 8,000 or 9,000 people in this city. And that's again because of the accessibility to tests and how we're doing with the contact tracing and follow-up as well. And I think that's another area that I've been educated on by the health experts. That's very important for us as government leaders to really understand. So when you think about that, we're far from those numbers. And until we can get somewhere in that neighborhood, I think presents at best a guess in terms of whether or not we have gotten enough people in this community tested. I am also excited, to let you know that Walmart is going to be conducting free tests in these upcoming weeks, and they'll make an announcement about that. So they'll be testing at the Atlanta Highway location here in Montgomery. So you will have Walmart doing theirs. You'll have the city of Montgomery partnering with HSI doing ours at a city site coming up in the next couple of weeks. We'll be able to test more people, but it's going to be a marathon. Again, it's not a sprint. And I said this for, since day one, that we have to be patient with this. And that's my approach to it. And hopefully that will be that of other leaders around the state of Alabama. Now, I want to just thank everyone again for joining us. I want to thank Ms. Edwards for being involved in this and offering some solutions and some ideas that we can all utilize during this time. I want to let you know that there's supposed to be bad weather coming up this weekend, and I just want to give thanks to our sanitation department, our street maintenance crews who have been out there on the front lines of this since day one and continue to do that. And just want everybody to stay safe. We also want to let you know that you can go to mgmready.com for any additional information that you may need. We update that consistently with all of the information that I get from national health experts and best practices that we can implement to make it simple and easy for you to find. We certainly want you to make sure that you text MGM SAFE at 888-777 if you would like to get more up-to-date information regarding what the city is doing and what new alerts may be out there regarding the COVID-19 pandemic. And then lastly, but certainly very importantly, as I was just reminded today, as it relates to the federal stimulus. The federal stimulus dollars are being allocated based on population of cities and counties. And so it's very important that if you have not filled out your census form, you go to my2020census.gov. That's my2020census.gov. And please fill out that census form, because that's going to be very important in terms of how federal dollars are allocated to Montgomery for us to kind of get back on the right track here, both on the community side and the wellness side, but also on the economic side and what we're able to do. So I just want to encourage everyone to do that and share that as much as you can. We must be counted. We have to make sure that we get all the tax dollars for all the government services that Ms. Edwards spoke about earlier today, but also for services that impact our public education, our public safety, and so many other areas of city and county government. We need you to be counted, and we want you to share it with your friends, just like y'all did those memes of me a couple of weeks ago. So share those with everybody and make sure you get those filled out. And thanks again for all the work that you've done in this community to keep us together. We know it's been tough. We know it's been inconvenient at times, but we thank you for your patience and your cooperation. And together we'll get through this. Thanks a lot. Stay safe. Stay at home as much as you can.